Echinococcus granulosus, Tinea echinococcus, and Hydatid disease. Dogs are the definitive hosts of the tiny tapeworm Echinococcus granulosus. The larval stage, a hydatid cyst, normally occurs in sheep, cattle, camels, and other animals that are infected from contaminated pastures or water. By handling a dog or drinking contaminated water, humans may ingest eggs. The embryo is liberated from the ovum in the small intestine and invades the blood stream, spreading to the liver. The resultant cyst grows very slowly, sometimes intermittently. It is composed of an enveloping fibrous pericyst, laminated hyaline membrane, that is ectocyst, and inner germinal layers, endocyst, that give rise to daughter cysts, or a germinating cystic broad capsule in which larvae protoscoleces develop. Over time, some cysts calcify and become non-viable. The disease is common in the Middle East, North and East Africa, Australia, and Argentina. Foci of infection persist in the UK, in rural Wales and Scotland. Echinococcus multilocularis, which has a cycle between foxes and voles, causes a similar but more severe infection. Alveolar hydatid disease, which invades the liver like cancer. Now the clinical features. A hydatid cyst is typically acquired in childhood and after growing for years may cause pressure symptoms. These vary depending on the site involved. In nearly 75% of patients with hydatid disease, the right lobe of the liver is invaded and contains a single cyst. In others, a cyst may be found in lung, bone, brain, or elsewhere. Investigations. The diagnosis depends on the clinical, radiological, and ultrasound findings in a patient that has close contact with the dogs in an endemic area. Complement fixation and ELISA are positive in 70 to 90% of patients. This figure shows hydatid disease. Figure A shows life cycle of Echinococcus granulosus. B shows daughter cyst removed at surgery, and C, within the daughter cyst are the protoscoliosis. Now management and prevention. Hydatid cyst should be excised wherever possible. Great care is taken to avoid spillage and cavities. Spillage and cavities are sterilized with 0.5% silver nitrate or 2.7% sodium chloride. Albendazole 400 mg twice daily for 3 months should also be used and is often combined with PAR. PAR means percutaneous puncture, aspiration, injection of scolicidal agent, and re-aspiration. Praziquantel 20 mg per kg twice daily for 14 days also kills protoscolices perioperatively. Prevention is difficult when there is a close association with dogs. Personal hygiene, satisfactory disposal of carcasses, meat inspection, and deworming of dogs reduces the prevalence of disease.